Hello, I am Leilani Clower, coding educator for cardiology, and we're here today to review APP billing scenarios and how it works in your workflows.
I am Regina Martin. I am the Senior Clinical Manager for Clinic Operations Department, and I'll be assisting you today with learning the clicks for how to set your billing.
Okay, let's start with a few Emory definitions. The billing provider is the provider that is listed on the claim that gets the credit for billing for the services. The supervising provider is a physician that provides the direct supervision to the APP. This information is used in your clinical work files, and it is listed as the billing provider for Medicare when Incident to guidelines have been met. The rendering provider is you, the APP, who actually provides the service. Incident to rules. Incident to is a Medicare construct. It only applies to the office-based services, to established patients. The patients have to have a treatment plan that's already been put in place by a physician with no new complaints or problems, and you must have a physician in the office to provide direct supervision. All right, scenario 1. Mr. Jones is a 79-year-old male with Medicare Part B. He's coming in for a scheduled follow-up. 6 weeks ago, he was seen and given a new prescription for his hypertension. The APP sees the patient when he's in today. There's no new complaints. The hypertension is well controlled on the new medication. The patient is to return in 6 months per the protocol. Dr. Test 1 Bio is in the suite and has agreed to be the supervising physician. In this case, the Incident to guidelines have been met. The services will be billed with Dr. Test 1 Bio as your supervising physician. The APP is billed as rendering to receive credit for the services, and you would bill the appropriate CPT code 99212 to 99215 based on the documentation.
So your part as the APP and billing for this service is relatively easy. So we're going to make it easier by sharing that with you. When you're looking at your quick orders and charges screen, you should see the insurance type in the patient information banner bar that's in the top left-hand corner. It's currently marked as a 1. So this patient has Medicare Part B. You would go through and click your level of service. I have that marked with a 2. You can also at this time place any other orders that may be necessary for that patient. For this example, I've only chosen your level of service, and everything that you click should show in the shopping cart, which is marked as number 3, and it's in the upper right-hand corner. However many clicks you make on this page, whatever you order on this page, that number will show in that shopping cart, and you will then click on the shopping cart to move forward. When you click the shopping cart, you'll see you'll be able to associate your diagnosis with your orders. You'll do that and then sign the order in the bottom right-hand corner of your orders for signature box. Click sign, and you'll see the orders for signature. You'll see your orders box pop up then. You'll see a details window, and there will be a blue circle with a white X for any order that has details that you need to complete. At this time, you'll click that, and you'll see the options come up for your supervising physician and your billing provider. You'll always need to enter your supervising physician. In this case, it was Test 1 Bio. You type in where it says details value. You will type in Test 1 Bio. If you have to do this for any other time for this patient in this visit, once this information is populated in this field, you won't have to type it again. So for a shortcut, I do recommend that you complete one complete order if you have multiple orders, and that way you won't have to enter the information again. Your next step will be, because this is an incident to billing scenario, you'll need to change the billing provider to the supervising provider. Your default is set as ordering provider, so anytime you have an incident to billing situation, you'll need to change that billing provider from ordering to provider to supervising provider, and that will place the bill for your attending physician. Once you've made that change, by clicking where you see the 2, you'll click sign, and that will complete your orders and charges.
All right. The next scenario is for Mrs. Smith, who is a 53-year-old female, and she has Blue Cross and Blue Shield HMO. She is seen by the APP for a sick visit. She has known CAD and has new onset dyspnea with fatigue and edema. The APP orders a stress echo and a return visit. There is a physician available by phone. Right. This does not apply to Incident 2 because the APP is not credentialed with the commercial payer. The services will be billed with the physician as the billing provider. The APP is billed as the rendering to receive the credit, and you just select the proper level of service, 99212 to 99215, based on the documentation.
So we'll go back to our quick orders and charges page. We'll select the appropriate level of service, and we'll see in the shopping cart that level of service. Again, we'll associate the appropriate diagnosis, click sign, go to our details window, click on the order, and you'll see the supervising provider. You'll add test 1 bio, who is the attending physician for this particular scenario, and you will not, in this scenario, need to make any changes. You would leave your billing provider as the ordering provider, which is you. Any changes that may be necessary for this would be made via test edit, so you wouldn't need to make any other changes from the default.
All right, our next scenario is Miss Nelson, 65-year-old female with Medicare Part B. She's had it for 2 months now. She's sent to cardiology from her PCP due to an abnormal EKG and chest pain. First visit with this specialty in almost 3 years, so almost a new patient, but the APP repeats the EKG, sends the patient for additional tests. This does not meet Incident 2 because it's a new problem. So the services will be billed by the APP as the billing and the rendering. The patient was seen by MA cardiology almost 3 years, but not quite, so it wouldn't be a new patient. So this would be an established office visit, 99212 to 99215, based on the documentation.
So again, we would go to our quick orders and charges page. We choose the level of service, any other orders, and go to our shopping cart. Once we've clicked the shopping cart, we'll associate any diagnosis and orders that we've made, click sign. You would go to your details window, you see your blue box with the white X, and enter your supervising provider. Again, we're still using test 1 bio. This is not an Incident 2, so you would not need to make any changes for your billing provider.
All right, the final scenario has to deal with Medicaid. If the patient is seen for, the patient is seen in follow-up to a recent hospitalization for acute chronic respiratory failure and acute heart failure. The APP evaluates and orders additional diagnostic services. The patient was seen by cardiology for the first time during the recent hospital stay. If the APP sees the patient for Medicaid, then the APP is going to be the billing and rendering. There is no Incident 2 for Medicaid, and you don't bill it under the physician because the services were provided by the APP. She would choose the appropriate established CPT code, 99212 to 99215, depending on the documentation.
And as we did before, we'll go to your quick orders and charge page, enter your orders, enter your level of service, click your shopping cart, associate your diagnosis, sign those orders, click into the order, and enter your supervising provider. Again, in this scenario, You would leave the defaults as set because this is not incident 2. So we'd also like to go over a couple of things for the APPs to make sure you're able to renew medications as needed. If you don't have prescriptive authority according to credentialing, you have 2 actions to complete when you're renewing a medication. Again, the blue circles in the details section will guide you to where you need to change your information. So you would go to those orders, right-click the order that you were trying to renew for that medication, and you see the tab for renew. You would click renew, and then you would see the blue circle with the X on the orders that need to be changed. You would click that order to go into your details and add your supervising provider. Once you've added the supervising provider, you can finish any other details that are necessary and click sign. You should see another blue X. You may need to scroll down so that you can see the X in your details orders. Once you see the other blue X, you'll need to right-click that one and add an ordering provider. The ordering physician box will pop up, and you will add Test 1 Bio or the name of your attending in that box. And this will allow that order to go through. Again, if you have multiple orders that you need to perform this on, once you've entered your supervising provider, that information will populate automatically. I recommend completing one order fully, and that way the information will populate for the rest of your orders as you go through the process. This should decrease the number of clicks you have when you're going through this process. Anytime you see that blue X, you will go ahead and click there and add the necessary information. Once you've added your supervising provider and it's populating automatically, you would just need to make sure you add any SIG information. For this screen, if you are e-scribing and you don't see your pharmacies for that particular patient, it may be that your ordering provider needs to be added. So for that section, for that patient, you would need to go into one of your orders, right-click, click your ordering physician tab, and add the ordering physician information in that box. And that will allow your pharmacies to show so that you can e-scribe for that patient. Once you do that, click OK, and your information should be there as expected.
Thank you. If you have any questions, you can please just give us a call.